Photo rejuvenation is also called a photofacial. The specific technology we have is the BBL Hero. And again, the Cyton is the Rolls Royce of when it comes to lasers. So the BBL Hero is it's a wavelength of light. So it's not a true laser, and it has two targets. So its target can be melanin or pigment, or its target can be oxyhemoglobin, so redness, broken capillaries. Photo rejuvenation is really great for flat pigmentation on the skin, so sun damage. It's also great for small little broken capillaries, rosacea. If someone gets at least 2 treatments a year for several years, they can have an anti-aging effect, but overall we're treating sun damage, redness, broken capillaries, rosacea. Yeah, we see probably a split of about 50-50 now that patients are wearing sunscreen more. They're not spending the time in tanning beds. We see less pigment. A lot of times that's in our older patients, so we're still continuing to treat that. But we do see a lot of redness, rosacea, broken capillaries as well. It's probably a good 50-50 split. Now, when we do perform a treatment, we do treat for all concerns. So if a patient has broken capillaries, if they have just generalized redness, if they have sun damage, we're treating all that in the treatment. It's all inclusive in the price for the treatment. This is another one of those treatments where it's not one and done. You really need a series, and then there's a maintenance after that, like most procedures. If someone's biggest concern is pigment, we would routinely recommend 1 treatment a month for 3 months. If their concern is primarily redness, broken capillaries, we'll often recommend 1 treatment a month for 5 months. And then usually treatments after that, minimum 2 a year. We'd recommend quarterly, maybe leave off the summer in the future. So it's kind of a series to get started. Occasionally we may recommend 3 and a patient needs 5, or maybe we recommend 5 and the patient's fine with 3. Then we can always, if a patient purchases a package, we can always push those out in the future. So our clientele is mainly men and women. If a man comes in for BBL, IPL treatments, what we would recommend is for them to be shaved that day, because we're targeting melanin. It could potentially thin out their facial hair. Usually that's something that's transient and not permanent, but we would want to numb the area where they have hair, just because it's a lot more uncomfortable. But many of the men we treat may just decide to treat kind of the upper 2/3 of their face, and then we wouldn't necessarily need to numb the lower face. But women of all ages we're seeing as well. And with women, we don't routinely numb. This procedure does kind of also like the laser hair removal. It feels kind of like a bee sting, but it's also a very bright light, so we use protective eyewear. With our old BBL machine, and we recently upgraded to the Hero, it was much slower, it was a little more painful. The nice thing about the BBL Hero is it's a much quicker approach. We can treat reds and browns much quicker, and the time that you're here receiving the treatment is lessened.